So gut health is talked about all the time. There's books on it, there's magazine articles, and all over the television we're hearing about gut health. And the obvious things are bloating, constipation, gas, burping, belching, right? Anything that's associated with the GI tract. What most people don't realize is there are a ton of symptoms that seem to have absolutely nothing to do with gut health, and yet I'll tell you really do. So, a couple ideas just to think about. If you're having trouble focusing, or what we like to refer to as brain fog or memory loss, could be a gut issue. If you are having trouble with joint pain, feeling kind of achy throughout the day, could be gut health. What if you're not sleeping well at all, trouble falling asleep or staying asleep? There may be some other reasons for it, but that also can be triggered back to gut health. What if your thyroid has been off? We have patients all the time that are diagnosed with hypothyroidism. Sometimes the meds work and sometimes they don't, and yet that relates back to gut health. What if your hormones aren't being produced appropriately, whether they're the sex hormones or the brain chemicals that we need for mood? Could be gut health. So what's really interesting is when patients walk through the door and they don't have a laundry list of symptoms that relate back to, let's say, food or bowels, and we start to evaluate some of the things I threw out, when we do the testing or we do the investigation to look, we see how screwed up gut health really is. So if you're not feeling good, even without GI symptoms, but other ones that may not have an explanation, let's take a look at the gut and see if that's the underlying issue.